Their routine sale began with 5 people. By the time they were done, only 2 were left. Tomorrow, what happened in the Atlantic that cost Deborah her friends and almost her own life?
We have a Botox party underway. We'll get back to that in a second. You realize that of the 855,000 people that have Botox, 12% of the people who get it are men. Most users are white. The age range is 35 to 50. And Lisa Jaffe's in our Botox party headquarters. And Lisa, how are things going there?
You know what, Kent? What's interesting is that Botox is not the only thing that they do at these Botox parties, besides sipping on the sparkling water and eating all these appetizers. Kim is getting something else done. She's getting collagen in her lips?
Correct, collagen injection. Absolutely. And what it is to plump up the lip to give you 2 things. One is more volume and more definition of it.
How much of a problem has this caused for you when you look in the mirror in terms of how you feel about your face?
I just think that it's getting less right here as you get older, so I just want to, everybody wants those Angelina Jolie lips, so just plump them up a little bit.
And you know what, and actually for a little while they might look exactly like the Angelina Jolie lips too, because they're going to be plumped up to the extreme at the beginning?
Absolutely, and then in about 2 hours, 20% of the volume is going to be gone just because of the nature of the product.
Okay, before you apply the needle, hold on. Okay. Valerie's got a question.
Are the collagen injections safe?
Are they safe, these injections?
Yes, absolutely. Like for Botox, to come back to Botox, it's been used for about 30 years right now with no side effect.
Okay, but wait, in the Botox injections, you stayed up in the upper part of the face. You didn't go below here.
That's
Why
correct.
not? Why don't you do any Botox for the laugh lines or wrinkles?
You could do Botox
here?
sometimes. We do Botox right here. We do Botox for the what we call the smoker lines. The only thing you have to be very careful how much you're going to inject, because the risk is to have a droopy mouth.
And would it affect you? Like, can you eat?
Like
can you kiss? Can you do all that kind of stuff?
Yeah, and you drool too.
You drool as well?
You could.
Oh, are you joking? I'm taking
joking.
it all seriously.
Yeah, no, I'm joking.
One more quick question before you apply it here. Go ahead.
My mother-in-law would like to know if this is for men, too.
Yes, absolutely. As a matter of fact, we do more and more men now. Men represented only 15%, and now we're about 25%.
Wait, your mother-in-law wants to know that?
Yeah.
Oh, nice.
She's a widow.
Maybe that'll get her a date. Is that what you're saying? Does insurance cover Botox?
Neither Botox or collagen is covered by insurance, except Botox if you use it for Parkinson's disease or blepharospasm, things like that. But for cosmetic, no.
Okay, so why don't you go ahead and put this in her lip? And you know what, Kent, I was wondering if you could talk to Dr. Fleming again, because one of the things is we're talking about people getting noses like Nicole Kidman's and cheeks like Halle Berry's, but how many of those features are they getting are really the God-given features of those stars?
Well, that's a good question. Richard Fleming's on the phone with us with annual Hollywood's Hottest Looks. How many of the stars have had actually the surgery done, Doctor?
It's easier to answer how many have not. It's necessary for them in their work to maintain, to present the best physical features they can. It's part of their work. So most have had some sort of cosmetic surgery.
So can you name some names? I don't want to put you on the spot. Anybody that comes to mind?
Well, some people have been very frank about it. Phyllis Diller, she's talked about it. Cher's talked about it.
Right.
There's many of them who have admitted it, although most do not want to share that with the public, and they don't.
How about Michael Douglas? I mean, it looks kind of like he has.
Well, if you look at, let me clarify, too, that anybody you ask me about that is my patient or I know them, I'm not going to respond.
Right.
But Michael Douglas, we're all fans. We enjoy his work. He looks better now than he did 5 years ago, 8 years ago. It's not because of his guru, his nutrition, his herbs, his exercise routine. He looks much better. And you'd have to live in a closet not to notice the difference with somebody like Michael Douglas, who's doing so much work and is out there in the press constantly. Of course, he's had something done.
I want to go
he
through.
Looks better.
Yeah, he does. I want to go through some of the other looks that people are going for. Cheeks, you say Halle Berry's big, is that right?
Yes. People love her cheeks. Kim Cattrall, they talk about Stella Ward. Those are the kinds of cheeks that they come in and request. Or not that they're requesting those, but just explaining what they like. It was like last year, Jennifer Lopez, J-Lo's. cheeks. Because she had so much exposure, she was well known. People would come in and say, that's the type of cheek that I would like to achieve.
What's your busiest time of year? I mean, when do people like come to you, the big stars?
Well, the only time it's really slow is right after the holidays. It's a little bit slower then. Otherwise, it's pretty much the same all year. A really heavy time for the celebrity patients is between Oscar nominations and the actual Oscar show.
I believe that for some reason.
Hey, Ken?
That's like tax season for an accountant.
Lisa has a question. Yeah, Lisa?
You were talking about J-Lo's cheeks. Which ones? You know what I mean?
That's a great question. I don't have requests for her tushy.
You don't?
But definitely requests for her facial cheeks.
Do some people want bigger, bottoms?
Tushies?
Yeah.
No.
Oh, they
Very
don't?
seldom.
Okay.
Very, very seldom.
So when it comes to bodies, I mean, like all body sculpting, who are the bodies they kind of like? Is Britney big?
Like this last year, the bodies they most mentioned were Britney Spears.
Okay.
They did mention J-Lo, and they did talk about Angelina Jolie.
What's the weirdest request you've ever had? Can you say that?
Been doing this for 25 years, so there's a lot of anecdotal stories. I think probably the strangest was a man who came into the office and was a professional gambler and was not allowed in the casinos in Vegas. And he wanted to change his look, but he wanted to guarantee that nobody would recognize him. That's probably one of the strangest.
Wonderful stuff. And I hear laughing going on in the background. Richard, thank you so much. We're going to get back to our Botox party here in just a moment as Northwest Afternoon continues.
Enjoy.
Botox sales, $309 million in 2001. Isn't that amazing? Some analysts say the number could top $1 billion in the next few years. You just got back from the party. How was it?
It was fun.
I didn't see any shots coming your way.
No, I got the shrimp and the sparkling water.
You ate all the food. Yeah, great.
Okay, if you could do anything. They've wanted to get their hands all over you.
I know. What is it? Is it just what?
Is it because of this?
Is
up
it the
here?
lines here?
What is it?
Yes, it would be for the line.
Has that ever bothered you?
No, I never even thought of it really.
Make a furrowed brow. Okay, now look like you're really angry. Okay, raise an eyebrow like you're flirting or something. Is it true that if he had Botox all up here, that would be frozen and he wouldn't be able to do any of that?
Yes and no. What we try to do is that depending on the expression of the patient, we're going to try to put, a lot or less, depending what we want to do.
But wouldn't that be weird if you couldn't do those things?
I don't know. I'm looking at your... Now, have you done it to yourself?
That's correct.
If you look at your head, there are no wrinkles whatsoever.
Yeah. I had 2 big wrinkles coming from my family side, and...
In fact, I want to stand over there.
I'm wondering, no, wait, did you do it to yourself?
No.
Okay.
No.
I want to get by you. I want to just stand by you here.
Courageous.
Okay.
So, see if you can see the difference between...
Who's older? Sorry.
Ticks me off. Good gosh.
Hey, you could have had a free shot back at the party.
You could really see the difference.
Yeah, you could, definitely. And there's also an adjunct effect of it, is if you have migraine, there's a good chance that it's going to take your migraine away.
Oh,
you're kidding?
Yeah, we start using Botox for migraine now.
Rosie, in our audience, you were furrowing your brow at this whole procedure, weren't you?
Yes.
What do you think about this?
I just don't think it's worth it.
What, $200, $300, and you could take years off your life, and
all that pain and
it was just like a pinch. It felt like this. Still not worth it.
no.
Judy with a question. Judy.
Well, it seems a little spendy to me. For how long will this last? Is it a month, a year?
It lasts between 2 months to 6 months, and in general, it's about 4 months.
So then you'd have to redo it again.
That's correct.
Hey, another excuse for a party. Right?
But the more you do it, in fact, the longer it's going to last.
Okay, now, Liz, at the beginning of the show, you worked on the lines around her face, and I hate to call them crow's feet. That just sounds so bad, doesn't it? Because I love her lines around her face. Don't you?
They're great.
I do. I love them. You hate them. But am I going to see a difference?
Yes.
Right today?
No, not today. It takes about 72 hours to have the first effect of the Botox. 3 days.
Okay, so 2 days. And then what do you think? Now that you've gone through the procedure, would you have it done anywhere else?
Never.
Anywhere else on your face, not with somebody else.
These would be great.
Get right here.
Yeah, so I don't look.
Well, I noticed when you did her, the one shot here, but I mean, I got a roadmap up here. So I mean, is it like how multiple shots?
Oh, for you, yes.
You do $22,000 worth.